The genesis of the Highground Hackers was December the 14th of 2012 with the Sandy Hook massacre. And I was activated personally to try and do something with technology to ensure that we can prevent a future Sandy Hook from occurring. And the Highground Hackathon is a means to connect developers with subject matter experts from organizations like the California Institute of Integral Studies to focus in on key issues related to gun violence and other public and civic issues to bring good, solid technical solutions to real problems. Mental health is a key issue, not only to gun violence, but broadly across the United States and the world in general. And so that's why we decided this time to focus specifically on different aspects of mental health and partner very strongly with the CIIS.
The goal is to build a bridge between mental health providers like myself and my other faculty and the other people in the community who are actually out there delivering mental health services with the tech community who have this access to tools and ideas and creativity and innovative spirit that we can really use to help broaden the services and come up with, hopefully, some solutions to some problems that just mental health service traditionally isn't able to tackle.
This weekend, we're looking to get solutions to, or at least what we call minimum viable products or proof of concepts of products that tackle subjects such as trauma, isolation, the prevention of violence in youth, and other mental health related issues that we could then incubate and move forward into subsequent hackathons that we're going to be holding and get them out into market to either help people that are helping people with mental health issues or people that actually have mental health issues themselves.
We're designing an iPhone app that helps you get directly in contact with a crisis responder. So you open your iPhone app and you can drop a pin where there's a crisis happening. Then a dispatcher will pair you with a crisis responder, and the crisis responder will call you and ask for details. And usually the person reporting the crisis is not also the person going through the crisis. So you would hope that somebody goes through a crisis and their buddy or somebody nearby who witnesses it opens the app and requests a responder.
Because we're here in San Francisco, we have the privilege of being closely connected with people in the tech community so that we can actually take the work that we're doing further, faster, create these partnerships.
I've had great conversations with various people from CIIS. They've been really helpful in steering me down the right path, bringing in different experts to help us with different parts of our app development. Everybody at this hackathon has a vested interest in spreading awareness on how to effectively respond, and so we're just trying to provide an additional tool to responders and to the public to empower them to take action in ways they weren't able to take action before.
Human services are limited to the presence of people, and so there's certainly nothing's going to ever replace the one-on-one connection that is necessary in a lot of troubling situations. But I understand that the use of an asynchronous tool, like an app that has a mental health component, like a website that has resources that people can use or that they can use interactively, that has so much more potential to add to the services that real live therapists are offering right now. And I know what the need is. I'm very clearly connected by all the clients that I've worked with, how I wish I could have been there more often than the typical 1 hour a week. And the tools that they're building right at this very second are things that are going to be available to people 24 hours a day and 7 days a week. They'll be there in those hours of need when someone like me I just can't be available. So I think that is the ideal partnership of the lived experience with the accessibility of some of these web-based tools.